Do you know the signs of a stroke, or how about the risk factors? Merritt Bates-Thomas, Green River District Health Department, is back with us to discuss these life-saving pieces of information. Good to see you.
Good morning, Angie.
Good morning. And it's, stroke is is prevalent. I mean, it happens all the time.
Southeast region of the United States has the highest prevalence.
And why do we?
Well, lifestyle habits, so many things can factor and figure into this. But I think, and I brought my list.
Bring your list.
You have the preventable or somewhat self-manageable risk factors that can lead to a stroke. So you've got high blood pressure. So many of these we've talked about on previous episodes. Heart disease, diabetes, smoking, birth control pills for women of childbearing age. One of the questions they ask is, do you have a family history of stroke? History of TIAs, elevated cholesterol, blood lipids, exercise, lower levels of exercise, obesity, if you drink alcohol excessively or use illegal drugs. And then the other thing that can possibly be preventable or manageable is for people who have arrhythmias or possibly have some underlying problem with the heart, like heart valve issues. But the things that can't be modified and why those preventable, modifiable type things are so important: age, race, gender, family history. We can't change that. It's given to us. Where you live, and we were talking about that at the very beginning. Access to care, and then some of the social factors too. Health equity is kind of the catchphrase now that we're all talking more about and resolving to do more about.
Well, and it's so important, if you're not in that demographic or age group who really struggles with availability of resources, that's deadly. If it doesn't affect you, sometimes it's hard to see that there's an issue. Yes, indeed. And so this is just really raising awareness. So, all right, now we know some of the things we can do. What are you doing at the health department to really encourage people to take control? Greater awareness, which this helps shed a light on that. I think the key thing, and we've talked about the program before, we have our self-measured blood pressure monitoring program, CareDirect. Self-referrals are accepted. Physician referrals are accepted. The thing about a blood pressure monitor, checking your blood pressure and knowing that it's elevated if you're not taking any sort of control of what's going on, you're just watching your blood pressure. So the key is to take action. Watch the foods you eat, be more active, live a healthier lifestyle, engage your physician, get regular self-care as you need it. Well, and if you think you are having a stroke, I know time is of the essence. Yes, so be fast. If you notice issues with balance, with your eyes, vision, things around that, your face drooping, especially in the arms, a weakness that's prevalent on just one side of your body. And then your speech. If you feel like you're talking or trying to say something and you can't form the words. And then the T in be fast is time to call 911. Right. It's always better to err on the side of caution, yes, even if it's not, and hopefully it's not. Can we find all this information on your website? The information is not on the website. Since it's Stroke Awareness Month, what we're going to be doing is having periodic Facebook posts. Oh, good, okay. So, and then feel free to call the health department, ask for me, and we can get people signed up for CareDirect. CareDirect. Merritt, thank you. Thank you, Angie.